ABG as something that is very useful, and it's basically tells you what the patient is doing and something you should expect, right? And this is the way I'm going to do it. I'm going to put in the table form so that it can be easy for you. So this is the imbalance that you will see, right? What are the causes? And then the compensation. So that's what usually you see when they give you these kind of cases. You see these kind of cases. So the compensation or compensatory mechanism that you see will happen. And this, I want you to do this. You can use this table so easily. So what is the imbalance, the acid-base status? You see what is the causes of it and what compensatory mechanism is going to be involved to fix it. Let's try metabolic. Okay. Acidosis. Metabolic acidosis is, think about the things that will cause it. It's straightforward, right? If somebody have a DKA, it's a metabolic acidosis, right? Example of that. If you have like lactic acidosis, think about it. You start running, you start having cramps. What are you going to be doing? If somebody have DKA and you see them, what are they going to be doing? That is all you need to worry about. If you have a lot of diarrhea, what will you be showing? What signs of symptoms will you show? If you take a lot of aspirin, it's an example of metabolic acidosis. And people who have renal failure, they always have a metabolic acidosis. Have you seen a patient who has DKA before? If you've seen that, you know what the compensation should be. Have you run before and you get cramps in your leg? What did you do? When you start having cramps, what do you do physically? This is the way I want to think about it. When you have metabolic acidosis, the compensation, flip it. What is metabolic? It's respiratory. What is acidosis? The opposite of acidosis is alkalosis. You see, you already know what you're supposed to do. Respiratory alkalosis is the compensation for metabolic acidosis. Flip the words they've given you. That means the patient should be behaving like they have respiratory alkalosis. And what does that mean? They're going to be hyperventilating. It's not that what you see with a DKA patient, lactic acidosis, somebody with renal failure, or you take a bunch of aspirin. That is the compensation you will see. Therefore, when you're looking at the ABG and you're checking if there's compensation, if you define metabolic acidosis and you want to know if there is compensation, look for respiratory alkalosis. See if the CO2 is going down. That's what it means. So low CO2, right? You don't have to memorize, like I said. These kind of content with medicine, it has to make sense. Do you memorize it? No. I know metabolic acidosis. If I'm looking for compensation, then I should be looking for respiratory alkalosis. I know everybody know how to define the acidosis and everything, but then when it comes to compensation, you get lost. The opposite is metabolic alkalosis. You can give me examples. You know examples of things that can do that. If I put an NG tube in, I suck all your acid, you develop metabolic alkalosis. If you start vomiting, you're going to develop metabolic alkalosis, right? If you have an excessive diuresis, right? If I get rid of fluid from you, this is what will happen. These are the two things that you know will happen. The same strategy, right? Same strategy. If I tell you that the individual is on metabolic alkalosis, flip it. What is metabolic? It's respiratory, right? And what is alkalosis? Acidosis. What is acidosis? What will you do to have respiratory acidosis? A patient who have respiratory acidosis is hypoventilating. So it's going to increase their CO2 to achieve that. So you're looking for that on the ABG to see if there's compensation. Same thing. You can see the story never changed. It's all content and it's all based on clinical. So medicine is all clinical. It's not something you memorize in books. You have to understand. Respiratory acidosis, I already told you. If you decrease your respiratory drive, you develop respiratory acidosis. If you give somebody benzos, that's what it's going to have, right? If you give somebody morphine, right, that's what they're going to do. Somebody who any sedation or COPD patient, this is what they're going to be. What do you think their compensation will be? Is opposite. What is respiratory? Metabolic. And what is acidosis? Is alkalosis. That means I need a bunch of bicarb. So I need bicarbonate. Your lung does not give you bicarbonate. There's only two organs you should be worried about, your kidney and your lung. Is the lung that get rid of the CO2 or retain CO2? Your kidney is responsible for your bicarb. Therefore, if I need metabolic alkalosis, the kidney should retain CO3, right? So this individual will be retaining. The kidney is going to increase your bicarbonate so that you can have compensation. To be able to compensate, you should be looking for high bicarbonate. And then you check. If you don't see it, you know that it's uncompensated problem. The opposite is the same. This is a very short lecture to show you like you can memorize this and then you have to figure out some way to remember them. If you undergoing respiratory alkalosis, I explain it to you. You blowing out your CO2. Somebody who is anxious, anxiety, hyperventilating, yeah, that's what is going to happen. If you're hyperventilating, this is what is going to happen. Okay, and if you have respiratory alkalosis, well, you should do metabolic what? Acidosis. Opposite, metabolic acidosis. What is metabolic acidosis? The kidney is going to lose a bunch of bicarb. That's all. This is your table. This is your compensation. That's how to remember them. It shouldn't be that difficult to like figure out. So let me show you an example. Um, an example how to see it. If I give you this normal ABG, like 7.49, right? And I give you 30. I give you 23. The way I do ABG, I don't do a bunch of stuff. All I look for my pH, I just set it to 7.4. My CO2, I just use 40. And my bicarb, I just use 24. This is what I use. That's all. When I finish, before I go for the range, but I use this. Even if you have 7.35, it's still not normal, guys. It's not normal. Some people think 7.3 because it's a normal range. When you're solving it, it's not normal. You have to be perfect. 7.4 CO2 has to be this and that. So from this, I look at it. If the pH is greater than 7.4, this is alkalosis, right? So I have an alkalosis problem. I know when I have alkalosis, the CO2 should do what? Should be very low, and the bicarb should be very high. The bicarb, look at it, it has not gone up. It's 34 range. Therefore, I know that's not what is responsible. The CO2 is responsible for that. So I have a respiratory alkalosis problem. If I have a respiratory alkalosis problem, what is my compensation? I told you, respiratory will become metabolic. Acidosis, alkalosis will be acidosis. So I'm looking for metabolic acidosis for the value that I did not use. I did not use this. I used this, the CO2, to tell me it's respiratory alkalosis. And thus is 23. Metabolic acidosis should go down. It's still 24, 23. It's a normal range. And therefore, I know this is not compensated. At the same time, the pH is not normal. This is how you do it. So this is just a respiratory alkalosis uncompensated because I don't see metabolic acidosis. Just straightforward, right? So that's that one. If I give you this, I'm using this as an example, how you can manipulate the numbers. If I change it to 7.50 and I give you 45, I give you 32. Once again, this is greater than 7.4. Therefore, I know this is an alkalosis, right? If it's an alkalosis, CO2 should go down to be responsible for this, right? But that means that's not the problem. I know it's the bicarb. Therefore, I have a metabolic problem. Metabolic alkalosis. What is your compensation? Flip it. Metabolic is respiratory. Alkalosis is acidosis. This is close to 40. It's not enough. It has to go up enough to make this pH low. Therefore, this is still metabolic alkalosis uncompensated. It's not even partially compensated because it's 7.5. It's way far away from 7.4. The same thing, I can manipulate it. I said, let me change it to 7. You can practice this on your own. I can just change something small and show you how the compensation will go. Let's keep the 32. I know the CO2 need to go up. If I change it to 55, this pH, and I put this pH as 4.1. 4.1. I made it 4.1. Still, let me clean this. I made it 4.1. This is still normal once again. Still not normal. It's still greater than 7.4, right? So this is still alkalosis. What is responsible? CO2 is supposed to go down to give you alkalosis. It went up. Therefore, I know bicarb is the problem. So this is a metabolic problem. What is my compensation? It should be respiratory, right? Respiratory alkalosis will be acidosis. What has happened? 55. This is consistent with respiratory acidosis, and the pH is closer. So this is compensated metabolic alkalosis. That is the way it's done. Respiratory alkalosis with metabolic alkalosis with respiratory acidosis compensation. So this is completely compensated problem. I'm going to change the same thing. I'm showing you how I can manipulate the numbers. If I give you 7.21 and I make this 40, I make this 15. This is an acid. So I have acidosis problem. What is the problem? Is this the problem? No, because it's normal. Therefore, I know it's the bicarb. So this is metabolic acidosis. What should be my compensation? Rewrite it. Metabolic should be respiratory, and acidosis should be alkalosis. Does this look like respiratory alkalosis? Respiratory alkalosis means CO2 should go down. It has not gone down. Therefore, this is just metabolic acidosis uncompensated. And that's the way you do it. If I change it, the same thing, I put a 15 there, and instead of the 40, I put like probably 35 here, or maybe 30. and I change this to 7.35. I change it to 7.35. Same thing, even though this is closer to normal, it's still an acidosis problem. And this is going down, so metabolic acidosis. I know my compensation should be respiratory alkalosis. Look at it. This is consistent with respiratory alkalosis. Therefore, this is compensated. It's still not normal. I mean, it's partially, I mean, you can, depending on which answers, they usually don't going to worry you with the partial compensation. The complete compensation is going to be 7.4. 3.5 is close to 7.4. So if there's a partial compensation here, if it's fully compensated, it's going to be 7.4. But this is the way you do ABG. And this is how you can figure out how to compensate. You just have to flip the numbers and see what is happening to each of them. If it's not consistent with what you do, yeah, that's why I give you this table. If you find it and it's a metabolic acidosis, you know your compensation should be respiratory alkalosis. Look at the numbers and see if it's consistent with the respiratory alkalosis. If it is, it's compensated fully. If not, it's uncompensated. If it's closer, it's partially compensated. Once again, this is Dr. NCLEX. Thank you for watching. Good luck.